simple. Eye floaters have nothing to do with all this front part of your eyes we can see here. But can you see this space which is painted here, a red? This is where eye floaters attack. And it will look something like this. I use a marker to show you exactly how it looks like. And it will be casting shadow at the back of your eyes here, which is called the retina. So that shadow is what you see as floaters. And they will be dropping down, dropping down until they settle here under your eyes so that they become less noticeable. Let me open up this eye model to show you exactly where these eye floaters attack and how do they exactly happen. So let me open your eye and you can see what is. Have you ever noticed tiny dots, threads or curve waves across your vision? They are called eye floaters and they could sometimes be incredibly annoying. Some people, when they see them, they even look up, look down, look to the side and side, hoping that they will go away, but they still remain there. Others even rub their eyes in hope that they will go away because they think the eye floaters are here on the surface of their eyes. But they're not actually on the surface of your eyes. They have nothing to do with the surface of your eyes here, but they attack the inside of your eyes. Let me open up this eye model to show you exactly where these eye floaters attack and how do they exactly happen. So let me open your eye and you can see what is inside. I know some of you never see what is inside of their eyes. So here is how it is. As you can see, this is how the inside of your eyes look like. This is the outer part of your eyes. And this is the iris which determines the color of your eyes, whether it is blue, green, black, or something like that. And you come inside. But let me make it simple. Eye floaters have nothing to do with all this front part of your eyes we can see here. But can you see this space which is painted here, a red? This is where eye floaters attack. Basically, this space is filled with the food, and they use this robot to represent how the fluid is inside of your eyes. Look at it here. This is how it is sitting inside of your eyes. So normally this fluid is gel-like and fresh as well. Think of it like a raw egg yolk. So it is fresh and smooth. Normally when you want to see something, a light enters your eyes from the front surface of your eyes to reach the back of your eyes. It will pass through this fluid smoothly to the back of your eyes. That was normal. But as you start becoming old or you have some eye issues like a retinal detachment, posterior vitreous detachment, and the rest, this fluid will start shrinking. Let me show it. You can see it here on the screen, how it's actually look like. It will start shrinking and it will look something like this. I use a marker to show you exactly how it looks like. So when light enters your eyes to reach the back of your eyes here, instead of it to pass smoothly, clumps of gels will prevent it from reaching the back of your eyes smoothly. And it will be casting shadow at the back of your eyes here, which is called the retina. So that shadow is what you see as floaters. So they are actually deeply here inside of your eyes. And that's why when you look up, you look down, you look to the side, hoping that it will go away. Or you rub your surface of your eyes, hoping that it will go away. It will still be there because it is deeply inside of your eyes. And I think most people say it. They become more noticeable when they look at a light, or when they look at the sky, or when they look at something that is bright. That is because the more light enters your eyes, the more shadow they will be casting at the back of your eyes, and the more you will be seeing them as floaters. And what you also have to know is that sometimes these eye floaters might become less noticeable, or you stop even seeing them at all. And then most times they are on the upper part of your eyes, and they will be dropping down until they settle here under your eyes so that they become less noticeable. And that's why sometimes if it is just a normal eye floaters as a result of ages, maybe you are from 50 years and above, you might start noticing them less because they start settling down on the bottom of your eyes here. But the most important thing to know here is that whether they are normal or not normal, how can you get rid of them? And that entirely depends on your case. And that is what I will explain exactly in my next video here. So you can check it out.